First, I want to report that we have confirmed, as Premier mentioned, 56 new cases of COVID-19 in the province. This includes 2 new cases at the Mackenzie Town Long-Term Care Facility, which brings the total number of cases at this facility to 15. There have now been 542 cases identified in our province. We suspect up to 42 of these total cases may be community transmission from an unknown source, which is an increase of 8 from yesterday. Currently, 23 individuals are being treated in hospital, 10 of those in the ICU. I'm pleased to share that we can confirm that 33 Albertans have recovered, an increase of 6 from yesterday. These recoveries are included in the 542 total cases. The number of cases of community transmission in the province is steadily rising. Across Canada, over half of all new cases are now linked to spread in the community. Stronger intervention measures are needed now to slow the spread of this virus. Premier Kenney already shared that effective today, all gatherings in the province must be limited to 15 people or fewer, and social distancing of 2 meters must be observed. Additionally, Albertans are restricted from accessing close contact services. A complete list of services affected is available on the alberta.ca website. It is important to remember that even when a gathering is smaller than 15, Albertans must still follow all public health measures that we've put in place. No matter where you are or what you're doing, practice social distancing by staying 2 meters apart at all times. No matter the work site or gathering place, take steps to make sure that anyone who is ill does not attend. If you are feeling unwell, you must stay home. Our health system is also taking new steps to prepare for the increase in new cases related to COVID-19. Effective immediately, Alberta Health Services will be postponing any diagnostic imaging procedures that are considered non-urgent by the ordering physician. To be clear, anyone needing outpatient or emergent outpatient CTs and MRI scans will still receive one. This will help limit opportunities for the virus to spread by limiting the amount of people entering our diagnostic imaging facilities. As well, Alberta Precision Laboratories and DynaLife are asking physicians and community providers to immediately stop all non-essential and routine laboratory testing. Any blood work that is critical to a patient's immediate care will continue to be tested, but we must free up more lab space for our aggressive COVID-19 testing. This will help us relieve the strain on the laboratory system and free up more resources for testing related to COVID-19. To help ease the demand on our hard-working healthcare professionals, the College of Physicians and Surgeons of Alberta has developed a tool for Alberta physicians to self-report their ability to be redeployed for clinical services during the COVID-19 pandemic. The aggressive measures we're taking today are not ones we take lightly, and I know they will impact the lives of many people. These restrictions were chosen after detailed analysis of spread within our province and consideration of what other jurisdictions have done. As we have done from the start, we are assessing the situation and responding accordingly. I recognize that these measures are fundamentally reshaping people's lives. As I have said, we know that these measures may need to be in place for many weeks or even months. This is a delicate balance, and we are implementing the restrictions that appear right for the situation in Alberta at this time. Each of us must continue to do everything we can to flatten the curve and keep our friends and family and ourselves healthy. This weekend, please practice social distancing in every facet of your lives. Stay home if you can. If you are healthy and want to get out for fresh air, please do so, but stay 2 meters away from anyone else and keep away from crowded trails and parks. I want to stress that those who fall ill with COVID-19 symptoms or any other illness have not done anything wrong and should not be treated as if they should be punished. I urge you to reach out to those you know who are feeling unwell and try to support them, perhaps by texting, calling, or dropping off food. Those who are experiencing any symptoms, no matter how mild they seem, should share that information with their employer. I want to stress overall that the future of this pandemic is in all of our hands. We have a say in how COVID-19 will impact our province. The measures we are putting in place today are significant, but they are small compared to the hundreds of decisions that each of us must make every day. So please, it seems small, but wash your hands regularly. Stay home if you're feeling sick, and stay away from others even in your own household if you are not feeling well. We all have a role to play.